So as I mentioned at the start of this presentation, today's webinar is part of an initiative which the NCCDH has been hosting over the last year or so, looking at organizational capacity for health equity. And so since last year, we've been working with a learning circle of researchers and practitioners trying to explore what organizational capacity for health equity looks like in the context of public health. We've also been working alongside two public health organizations as we delve into these issues. So as a group, we come together 4 to 6 times a year to explore various questions which are emerging from the literature and also which are of interest to the public health organizations who we have been working with. This is the third webinar we're doing as part of this series. The first webinar provided an overview of the initiative as well as what we call the organizational domains, which are those beehives you see on your screen. In the second webinar, we talked about organizational change capacity, so the capacity of organizations to actually develop and sustain change initiatives around health equity. The recordings of both webinars are available on our website, so if you did not attend those, you can view those at your own convenience. We will continue to present on this initiative as we go through. So as I mentioned today, our focus is going to be on organizational values. So as a group, as the Learning Circle, when we came together last year and we started talking about organizational capacity, we knew that organizational culture was a really important element, and at the same time there was this conversation about what kind of values do we need to be paying attention to as we shift organizational capacity for health equity. And so that was our entry point into the discussion on values. So as you know, organizational values really are a huge component of organizational culture, which is our focus for today's webinar. Each time we meet as a Learning Circle group, we have a few questions to guide our discussion. So these are the questions we took into the Learning Circle conversation. We were interested in what kinds of organizational values reflected health equity and supported or took away from health equity-related actions. And really importantly, how could organizations actually shift these values to be more supportive of actions? And so these questions typically guide a bit of a literature scan as well as the discussions we have when we come together as a group. So in advance of today's webinar, you all received an email which asked you to share with us 5 personal values which guide your work on health equity and the social determinants of health. And so we have that, and we'll share the results from that in a few minutes as we go through. But I'm also going to invite you all, especially if you didn't share this already, just to share with us the kinds of values which guide your work on health equity and the social determinants of health. And while those questions are coming in, I'm just going to respond to the question about the framework. So the framework I just shared earlier was is really a working framework which we have developed, drawing from the literature to support the work of this initiative. And we are just in the process of writing that up, and it will be available on our website in a few months. We also shared in advance of today's webinar a few questions for you to reflect on. So in addition to you sharing the values which guide your work in this area, we asked you to reflect on how you understand these values, how the values you named support health equity action, and what kinds of organizational policies and practices reflect this value. So in our Learning Circle discussions, we spent some time really on that last piece on organizational policies and practices. Because our practice sites are focused on community engagement as well as surveillance related to opioid use, we really spend a lot of time thinking about both general public health practice, but also practices related to community engagement and surveillance. So, what are values? We asked you to share a response to that question, the 5 values which guide your work, without actually ever telling you what we meant by values. So just to ground us in today's conversation, values are really the standards which we hold, which shape what we do, our behaviors, what we think, so our attitudes, and also what we imagine for ourselves, so our desires. We can think about values as in 2 big in two big domains. So we can think about values as being instrumental. So these are values which really guide what we do and what we expect each other to do. And so these are instrumental values. It can include things like being obedient or being loving or being ambitious or being kind. We can also think about values which are more ways of being. So the values related to freedom or equality or equity and respect. And so these values are all related. So typically in our work, we want to be asking ourselves, to what extent are our values which are related to the ways of being, so states of existence, like how do those relate to the ways in which we behave, in the ways in which our organizations behave? So a lot of our discussion really today and as a learning circle focused on that interplay between ways of being and ways of acting. We also recognize that while our initiative is focusing on organizational values, values do operate on multiple levels. So we have our individual values, we have values expressed at the organizational level, and all of this is existing within a broader societal context. A lot of you have been doing work on health equity, may be familiar with this idea that societal and cultural values are significant structural determinants of health. And so what we believe, our attitudes, beliefs at a societal level have a significant impact on the kinds of public and social policies we implement, which then impact other social determinants of health. So as I mentioned, our conversation really today we'll focus on organizational values, but we're very conscious of the fact that there is this interplay across multiple levels. So here we go. This is what you responded to the question, what are the 5 personal values guiding your work? If you're looking at the screen right now, you'll see that respect is right there in the middle, and it seems to be a value which a lot of us are bringing into our work on health equity and the determinants of health. We're also seeing social justice, responsibility, fairness, community, compassion, humility, dignity, integrity, kindness. So I think these values are a nice interplay between, the values which are about ways of being and also ways of doing, so things like collaboration. So again, thank you for sharing these. So we'll just have a poll that would like to hear from you about the extent to which your organization now has values which support health equity action, and are these values clearly articulated? So your options are yes, no, or you're not sure. All right, so thank you. The responses are coming in. So we've seen a lot of yeses. About 50% of people are saying yes. It's a bit split between no and people who are not sure. All right, so just give a few more seconds for those to come in. All right, great. So it's looking about, 65% of people are saying yes, we have values which support health equity action. Thank you for that. So for those of you who said yes to this question, if you can you just let us know in the chat box examples of these organizational values which support health equity action? As you drop in your responses, I'm now going to invite Claire to walk us through some of the organizational values which emerge from our literature scan. Off to you, Claire.